Hello learners, this is Habiba with Excel with me. If you like the video, please do like, share, subscribe and comment below. Let's start today's class, that is Teacher Eligibility Test, Paper 2, Social Studies, Class 8. In the previous class we have done with the Theme 1, Diversity of the Earth. Now Theme 2, Production, Exchange and Livelihoods. Chapter Money and Banking. What is the exchange of goods directly between each other without the use of money called? That is barter system. This was prevalent in the olden days when currency was not introduced. Which currency is easy to handle, more durable, forgery can be detected easily, waterproof and eco-friendly, recycling is easy. That is plastic or polymer currency. Which bank collects money deposits from the public and transfers these deposits from one person to another and also gives loans to businessmen, industrialists, farmers and individuals? That is commercial banks. What is the full form of BSBDA A? That is Basic Savings Bank Deposit Account. Now what is the full form of ATM? All of us know, Automated Teller Machine. Now what is the full form of SHG? That is Self-Help Group. Now the next chapter, that is Impact of Technology on Livelihoods. Who started the assembly line method of production to produce more cars quickly? That is Henry Ford of USA. Against what date many textile artisans protest violently in the 19th century in England? That was against the new power looms. That means hand looms were replaced by power looms. That is man-made things were replaced by the machine-made things. When were farmers able to produce more than 200 million tons of food grains every year? That was during 1990s and in the first decade of the 21st century. What is one of the most important paddy harvesting machines that harvests the crop, threshes it and separates the grain from the chaff? That is combined harvester. All the things are done combinedly. That's why this is called combined harvester, CH. What is the study on the use of CH in 2003, that is combined harvester in 2003 reported? Farmers are able to save about 1 quintal of grain per acre, which would have been otherwise lost during manual harvesting. Now combined harvester harvests paddy about 1 acre in 1 hour. What led to the displacement of laborers? That was extensive farm mechanization. That means machines were introduced because of which laborers were displaced. Who introduced powerloom production in India? The British. What is the major difference between a powerloom unit and a mill producing cloth? That is, a mill or factory may have hundreds of looms in a large space. It is a factory complex employing tens and hundreds of workers in different sections. Now a powerloom unit will have only a small number of workers and is established at home with a few looms or in a relatively smaller space such as in workshop sheds. Which states in India have a large number of powerloom units? They are Tamil Nadu, Maharashtra, Gujarat, Uttar Pradesh. Even Andhra Pradesh has also many number, but larger are in these states. Decline of handlooms. In 1988, there were 33 lakh handlooms operating in different states, and 2009 and 10 this has come down to 24 lakh units. All over India, the mobile phones have grown from 50 lakh subscribers in 2001 to over 92.9 crore subscribers by May 2012. When was the mobile phone facilities introduced for the first time in India? That was from 1995. India's telecommunication network is the second largest in the world by number of telephone users, both fixed and mobile phone, with 1,179.49 million subscribers as on 31st January 2021. Now, public health and the government. Which country is the fourth largest producer of medicine in the world? That is India. At the village level, who helps people get health services? That is ASHA worker. Now, full form of ASHA, that is Accredited Social Health Activist. Which center in the village serves as a center to provide nutrition and immunization services to young children? That is the Anganwadi center. Now, full form of MPHA, that is multi-purpose health assistance. Now, primary health centers, that is PHC, are located in which level? That is Mandal level. In the rural areas, one finds RMP. RMP stands for Registered Medical Practitioner. Now, according to the World Health Organization WHO, poor nutrition contributes to 1 out of 2 deaths, that is 53%, associated with infectious diseases among children below 5 in developing countries. Now, in Andhra Pradesh, about 33% of children below 5 years of age were characterized as underweight. About 31% of women and 25% of men are undernourished. This can be asked as statements. Find the correct statements or wrong statements, like that you can get the question. Now, the next question, the Arogyasri scheme was started as a medical insurance scheme to white card holding families for treatment that requires hospitalization. Now, which numbers provide ambulance service? They are 104 and 108. Now, let's see quickly the Ministry of Health and Family Welfare, that is Department of Health and Family Welfare, takes care of the national level programs for disease control, hospitals and dispensaries and medical education. Then Department of Ayush, what does it do? Looks after local systems of medicine such as Ayurveda, homeopathy, Unani, Siddha and research in them. Next, Department of Health Research, that is concerned with research in medical and health activities. Then Department of AIDS Control. It takes up programs for prevention and control of AIDS, that is HIV. So, these are the important programs or departments here we should understand about, very important. We come to the end of this session. I will come with the next chapters in the next video. If you like the questions, please do like, share, subscribe and comment below. Thanks for your attention and time. Happy learning.